Hello, good evening, viewers, and welcome to your favorite medical show, Ask Dr. Saw. Tonight, Dr. Saw is back on base, and we are bringing the show to you live via Zoom. We'll be working like this here to bring it to you. We are committed to bringing the show to you, and we will bring it to you in the best way possible. I also want to apologize last week for the abrupt end to the program. We got disconnected. I'm so sorry, but we are going to answer that one question we missed last week. Also, remember that send in your questions and send in your, whatever you want to ask Dr. Saw about. You can ask him if it's not related to the topic we're dealing with tonight, which is gout. If it's not about that, then you can still send in your questions about any other medical questions you think that you want to send and ask Dr. Saw. So we have a few questions this evening, and we will be dealing with that at the end of the show, and the one from last week also that we missed. Good evening, Dr. Saw.
Hello, Akash. Good evening, and good evening to the viewers as well.
Yeah, I know you must be tired, work all day, gotten back, work all day, but
Yes,
but you're here doing this with us, man.
I got back yesterday, as you know. As the viewers know, I was in Mexico,
Yeah,
Cancun
you
for a
missed the
short
background.
little holiday, and the flight is crazy, man. 10 hours, close to 10
Okay.
hours. So I came back jet lag yesterday. It was hell for me to get out of bed this morning, and I had a full clinic.
All right.
So yeah, I plan to go to bed early, but it's what it is. As you say, we are committed to get this show going.
Right. So we have a full clinic tonight watching us live this evening also. So let's start this show this evening. Doc, this evening we are talking about gout. Now, viewers and Doc, I think we've touched on this subject a couple of times on in other while doing other subjects, but tonight we're going in depth with a little bit more of gout. And what I know about gout is that I hear people say it's very, very painful. But what is gout, Dr. Saw?
Yes, okay, let's give a little overview. I think I'm not quite sure if we have done gout. However, I know we have done a topic on arthritis, and gout may have been part of that topic. But I haven't gone through, the previous topics that I've done in detail to know which I haven't or haven't done. And there's no harm in, and the whole intention of this program is educational.
That's right.
And you can never have too much of something in terms of education. So the
Exactly.
more you have of it, long it will stay, hopefully, and it stays in the memory, and we learn a lot more about it. And there are things that are
Absolutely.
different. Every time you may say something that was new, or and you have a different take on it.
That's right.
But on the overview of arthritis, what is gout? Gout is a type of inflammatory arthritis. So inflammation is there's a key word. So it's a type
Yes.
of inflammatory arthritis that is caused by high uric acid or urate in the blood, and the formation of crystals, urate crystals in the joint and surrounding area. So, so let me break that down again,
Yes,
repeat
please.
it so we understand. So it's an inflammatory arthritis. I'll describe that in a minute. Caused by high uric acid in the blood. So there's something called uric acid that is high in the blood, and it causes crystallization or crystals formation in the joint, and it provokes an inflammatory response. And that is what is called gout. So, in essence, it's a type of arthritis. And we said before that arthritis means inflammation of a joint. So, when I break down arthritis in a previous topic, I talked about arthritis can be described or categorized in two big groups. You have the inflammatory arthritis, and then you have the wear and tear arthritis. So the inflammatory tell us that there is something in the body that is inflamed, or it is more characterized by a lot more inflammation. And what is inflammation? Redness, swelling, pains, and heat. That is characteristics of inflammation. And then you have the type of arthritis where people get wear and tear arthritis, where as they age, or if there is trauma to the joint, you have wear and tear. So you have erosion of the bone or the cartilage. So that is usually an aging process, or it can happen in young people if they're traumatized. If, let's say, for instance, runners or people who had trauma to the joint, you have more friction in the joint, and some deformity, and it causes like bone onto bone, and you have wear and tear. Whereas the other type of arthritis, the inflammatory type, is where the body mounts an inflammatory response. The whole area is red, it is swollen, it is hot. And there are different types of arthritis that are inflammatory, gout being one of them. The
Yes.
others would be things like rheumatoid arthritis. I don't know, you've heard of rheumatoid
Yes.
arthritis. Septic arthritis, if you have an infection of the joint, that's an inflammation as well. But in gout, we are talking about an inflammation as a result of a buildup of a salt, like uric acid crystals. So it's like a crystallization of a compound that provoke inflammation of the joint. Okay, that is your definition of gout.
Okay. Wow. But um, uh, uh, what causes this? Why do we get gout? I mean,
All right, correct.
yeah.
So it is important to understand why do we get it. And I mean, we may eat the same food, but I might get it and you might not.
Yeah.
So when I say acid, so uric acid the production of uric acid, you get it from a process called a metabolism of protein and purines and certain compound. You get formation of uric acid. So, in the formation of uric acid is usually a compound called purine metabolism. And purine is a compound found in cells, in building block of cells, for instance, the nucleus and the building material of cells. So, think of our body, it's got building material, and in the cells, you have purine bases, right? These are compound. Now, in the metabolism of that purine, of that compound in the body, it produces uric acid. So when you eat certain food, or if the body breaks down its own cells, so if I eat meat, certain red meat, for instance, or certain type of food, I have an increased intake of purine-rich food. Or if so that would cause increased production. And there are other causes of increased production. If our cells are broken down, it has to release that purine as well, because as I said, it's a building block of the cell. So for instance, patients who have cancer and the cells are dying, may have an increased production. In patients who have certain blood disorder, the cells are rapid turnover of cells, you have increased production of the uric acid. So the uric acid is a key component of the gout, and there are certain things will cause it. So one, increased production, and increased production due to either dietary, so I'm eating too much, and I'll tell you the food in a minute, or my body is breaking down its own cells. So cancer and psoriasis and certain disease can cause it. Or if our body is producing it, so when we produce uric acid, it is excreted by the kidney and the intestine. So if there is a deficiency in the production or the excretion, there is a buildup in the body, logically.
Absolutely right.
So
Yes.
you're
Hmm.
producing and you're meant to excrete it and maintain a certain steady state in the body. So why would that steady state increase? It would only increase if we are having too much, producing more, or if we are not excreting it. There is a buildup.
Oh, right.
So
Right.
that is a pathology, or that is a theory what happens in the body. So when there is a buildup now, you have it crystallizes and then gets into the joint and the surrounding area, and it causes swelling and redness and pain. And that is the mechanism of gout. Now, why do we get it? Another question. We know the mechanism. Why do we get it? Is that entirely that I can pinpoint one reason?
Okay.
Sometimes there's a combination of both reasons. That one, I'm eating too much excessive food that contain purine. And what are the foods? Red meat, um, seafood, certain seafood, or oily fish, shellfish, so prawns, shrimp, crab, oily fish like sardine, even though it's good for you, We say omega-3 and thing, they're all oily fish good for you. But you have sardine, anchovies, they can provoke or increase your risk. They increase uric acid production.
Hmm.
High sugar fructose, there's a fruit sugar called fructose.
Right.
You can have high fructose sugar. Food can promote formation of uric acid as well, and you have gout. Also, so that is the production. Also, genetically, our body can upregulate enzymes. So there are some metabolic processes that go on in the body, and if those enzymes are hyper stimulated or very active, they can increase production. And then in the excretion process, also our body meant to excrete the uric acid. Sometimes, and as I say, it is excreted by the kidney and the intestine. If that metabolic process is also deranged, genetically that can happen. And also if we have kidney disease. So if the kidney cannot filter this uric acid, what does a filter it meaning? Secrete it out to the body. If it doesn't do that well and excrete it out, it filters it out or secretes it out into the urine, you have a high production. So, those are the kind of theory behind it and the food that can provoke it. And.
Yeah, Doc, I want to ask you this here. Are certain people at risk, and is this in any way, is it hereditary?
Good. So there's a genetic predisposition, and as I said, when you look at the causes, we don't know why some people get it more than others, and they have looked at genetic profiling and genetic components, and yes, there's a genetic risk factor. So in the genetic of the body, the genetic controls the mechanism of metabolism, let's say, for instance, and there are some processes in the body that are genetically influenced.
Okay.
And yes, there is a genetic predisposition. So that's one. Two, there are other risk factors that people more at risk. For instance, it is more prevalent as you get older. So you'd find it in the population, let's say, average UK database say our population is about 1.7% of the population, probably 1.4% of the population, probably. Whereas if you look at the database of the elderly people over 75, about 7% of men and 4% of women. So you have it as you get older. So age is a factor. Secondly, men is more affected than women. So these are your risk factors. Men about 3 point something times over 3 times more than women. And they say younger women also, there are some estrogenic benefits that estrogen gives some benefit from gout. These are theoretical things. What else? If you have trauma to your joints or joints that are affected, an arthritic joint, they're more prone to it. And so these are your non-modifiable, let's say, risk factors, or people who are more prone in it. But others would be people who are obese, alcoholics, and
Yes.
people who drink a lot, and certain type of alcohol, like beers, if have higher purine-based product.
Okay.
So you're more at risk. But alcohol generally would provoke kidney disease. They are at a higher risk because, as I say, the kidney filters it
That's
or
right.
secretes it out,
Yeah.
excretes it. So you may be at high risk. Patients with heart failure, hyperparathyroidism, and some other general medical condition can make you more at risk. Metabolic syndrome, obesity. I don't know if I mentioned that. Those are
Yes, you did. Yeah.
risk factors. So those are your risk factors, and those are the people who are more prone at it. And as we said earlier, you and I may eat the same thing, but I get it and you don't get it because there's some components in our body that is genetically influenced, and there are other factors that we are totally different, and our body metabolic system is all different.
Wow. Doc, look, other than that hot, red, bulging bit on your foot sometimes that shows up as gout, you could see the pain. Look at it, you can see pain, you don't have to feel a pain to know how painful it is. Other than that, Doc, what are other signs and symptoms?
Signs. All right, classically, gout is really most of the patients that I see with gout, I make I would say I would make a clinical diagnosis, and usually it's right. So it's usually a remitting, relapsing condition. So you
Okay.
would have an arthritis that is provoked by, let's say, so lots of people come and say, Doc, I drank too much alcohol last night, or I've had too much of seafood last night, or I was dehydrated and I had this sudden onset of pain. So the characteristic of the type of arthritis is that you have a sudden onset of pain in your joint. And usually they say between 6 to 12 hours, it rapidly increases. So you're good and you just, 6 to 12 hours you start, your joint is inflamed, swollen, and very painful. And they say it's a very painful condition. I've never had it, but I know, it's
I
described as
repeat.
very painful. Now, characteristic of inflammation, you would have redness of the joint, swelling of the joint, and of course it's painful and it may be hot because of the inflammation. Of course, and also loss of normal function. So it would be swollen, you can't move it as much as you can, and because of the pain and because of the inflammation. Um, the thing is, the common joint that is affected you are usually the big toe. We call it the metatarsal phalangeal joint, the big toe. That's your classical joint, but of course, it can affect other joints of the foot, hand, usually the peripheral joints. So your foot and hand and your ankle, those are your wrists. They are common joints that are affected, but of course, it can affect your knee and other joints of the body. As the disease progresses, of course, you can have buildup of other things. So this uric acid is like a crystal, and it can get deposited in the eyes. So you have inflammation of the eye, and usually it's like a whitish substance deposited, and then it gets hard and like stone-like. Patients can get it deposited in their tissues of the body. The tissues of the body, in the heart, the throat, larynx, the tongue, your ears. You can get it in the ears. So patients, we call it tophi or tophus, singular, tophi, plural. The tophi would be like a chalky substance. So it's a
Right.
whitish chalky substance. It get hard, then it get like stone-like.
Yes.
And it can cause ulceration and inflammation. In your fingertips, you can get those signs as well. So if someone comes in with inflamed big toe or any joint as a matter of fact, and I look at their ears, their fingers, and I find they have tophus, these hard, lumpy, brittly kind of stuff, I may say this is gout. But there are ways of making the diagnosis, and there are tests we can do. I'll tell you about that in a minute. But the giveaway really in the diagnosis is the recurrent nature of it, the sudden onset, and the risk factors. So you are coming to tell me that. So if you come in with a joint swelling and redness and pain, I would ask you a couple of things. First question I would ask you, did you hurt your joint? Was it an injury related? That's the first question. So if I bang my knee or my foot and it's swollen and red, and I can think, okay, right, I've got an abscess in my foot or I've got something else. First thing I'll think, hey, it's an injury.
Right.
Logically, correct?
Yes. Yes.
Go ahead.
Go. No, Doc. I was going to remind you something. While you're talking about all of this here, one of our
Hmm.
viewers a couple of months back, it had to have been sometime maybe early this year, mentioned
Hmm.
on our show that sometimes she has crystals coming out of her eyes. Remember? I don't know if you remember.
Yes, yes, I remember that actually.
Remember
Yes,
that? And
yes.
now you're telling me when you talk about this, where how this crystal is
Yes.
forming. I'm saying here you are. I know this viewer is watching right now. I know you're
But I
watching.
think, if I'm not wrong, I'm not an ophthalmologist, but there is another crystallized condition of the eye that you can have crystal formation. I
Okay.
need to look at that. I read that somewhere. I need to
Okay, great.
look into
But
that.
but but
But
just that
I
I'm,
mean,
you're talking about this crystal in the eye and silicon form. I'm thinking that this
yeah,
viewer that is here with us,
yeah, yeah.
always
There is another condition of the eye that can cause crystallization and crystal formation.
okay, brilliant.
But it may
Um,
very well be as well, as you say, crystal formation in the eye can also cause from gout, tophi,
that's right.
or
Yeah.
yeah.
So we got 5 minutes more, Doc, for you to if you finish with signs. Are you finished with signs and symptoms though?
Yeah, that's your sign and symptoms basically, because most time it's confined to the joint. So most people would have the inflammation in the joint, it's confined there, it's red hot, it's swollen. I mean, the important thing in establishing if this is gout or something else, the one critical thing I would tell patient, if you know it's not an injury, so you know you haven't hurt yourself,
Yes.
um, you want to make sure it is not infection related, because that might be dangerous. Because if you have an infection and septic arthritis is a condition called septic arthritis. It can lead to destruction of the joint and rapid movement of bacteria into your blood and damage the bone. So if you have septic arthritis, that's a medical emergency. So you don't want to sit around thinking it's gout and it's septic arthritis. But the giveaway, I think, would be in septic arthritis, it would be a progressive disease that you take your couple of Advil and your ibuprofen and wouldn't get better. It will get worse. And secondly, you may have fever with it.
All
So,
right.
like an infection, like you have an infection going on, it will continue to get worse unless it is treated with antibiotics and other things. Because in the joint, sometimes you have to go and do wash out of the joint. You have to actually do a surgery. So that would be the differential diagnosis that I will be, very cautious with, or very, on the lookout for, that I don't mix up gout with a type of infection.
Brilliant. All right. So we got a couple of questions from we got one question from last week we didn't get, and I got like four questions for you.
Before we go to the question,
No, no, no.
let me
I want
quickly.
to talk. I was gonna say I want to talk to you about treatment first before I go to
Oh
the
yeah, yeah,
question.
because I
So
want
we're
to
gonna
talk
keep it
about
within the time
treatment.
span. We're gonna keep it within the time span. All right.
Okay, fine with me.
I know. I know. I gotta talk. We gotta talk about treatment, doc. You're the
Okay,
doctor.
quickly on some investigation. So to make the diagnosis, generally you can make it without doing the test. But classically, you'd want to check the uric acid level, and it may or may not be high. So to viewers, I just want to make this point. You may go to the doctor, he say, "Oh, you've got gout," and he send you for a blood test to check for your uric acid. But sometimes during an acute attack, the uric acid is normal. So if you check it and it's high, then you can say, fine, this is almost gout. If you check it and it is normal, it can still be gout. And you need to recheck it about a couple of weeks when the acute flare up goes away.
Okay.
So remember, that's one to remember. To make a definitive diagnosis, what we can do, we can take some sample of the fluid in the joint and you put it under the microscope and you look at the color. So it does something called negative by fringent in light. It gives a different color.
Okay.
Yeah, so there's some color system in the polarized light to split because of the refraction, it causes a different color, split the rays of the light.
Okay.
Yeah.
Right.
So, okay, that's your diagnosis. Some other tests we can do, of course, you want to make sure it's not infection. You do inflammatory markers. If it's really bad, of course, you take a sample from the joint, you send it to the microscope to confirm, or you send it to the lab to see if there's bacteria in there. Any other differential diagnosis, you want to make sure it's not an injury. So things like X-ray, CT scan, MRI. X-ray will also show gout. You have erosion of the bone. And there are special signs we look for on an X-ray when the joint is destroyed. Management quickly in 2 minutes.
Yeah, 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 yeah.
Management. So there are two ways to manage gout. One, when you have an acute attack. So in an acute attack, there are different drugs you give. You give drugs to take away the inflammation. So the common drug used would be ibuprofen family. So ibuprofen, naproxen, indomethacin, those are drugs used in the old days, but we still use, we call it NSAIDs, non-steroidal anti-inflammatory. This is the ibuprofen type of drug.
Yeah, yeah.
Then you have a drug called colchicine. You must have heard of colchicine is another drug, so they're anti-inflammatory. And then you have another drug, you can use steroids. That is oral steroids, or you can inject it into the joint. This is like prednisolone and methylprednisolone, steroid type of drug. That is for your acute management. Now, then you have a drug that you give to prevent. So when we check the uric acid, and if your uric acid is high, for you to prevent recurrent attack, you want to bring the uric acid down. It's like if I tell a patient your cholesterol is high and you've got a heart attack. I'll treat the heart attack, but if I don't treat the cholesterol, you might get a second heart attack. So
Right.
I give you a drug to bring the cholesterol down. So likewise with gout, you have high uric acid in your body, it causes a joint, it affects the joint. I will treat the joint with anti-inflammatory, but I also, if I don't treat the uric acid and bring it down to a normal level, you will continue to have attacks. And the attacks can be very painful and disabling. So then I have to treat that, bring the uric acid down. I can do that by a couple of ways. I can give you drug to, one second, say there's a reminder that we have less than 10 minutes.
Okay, great.
Yeah. There's also, so the two drugs we then use, two classes of drug. We give drug to decrease production of the uric acid or to increase excretion of uric acid. So common drugs to decrease production would be allopurinol, and febuxostat is another drug to decrease the production. And then you have drugs like probenecid, another drug to decrease the excretion. So that's your treatment in summary. But fine, if there's gout, see your doctor, there's treatment for it. You can be better and avoid lots of things. Patients with gout can also have increased risk of kidney stones, uric acid kidney stones. So it's something that you need to look into.
All right, Doc. Thank you so much for this evening for telling us so much about gout. Now we got some questions that are coming from our viewers for that we missed last week. And that question was, why do we get leg cramps?
Okay, so that's it's a difficult one as to why we get it. I would say majority of cases, we don't know why.
Oh, really?
Yeah, it's called idiopathic cramps. So
Okay.
majority of patients who say, Doc, I've got leg cramps, I look for everything, can't find a cause, we don't know why. But we give them drugs like quinine sulfate.
Okay.
So quinine that you use
Yes,
normally,
yes.
you can use that with gin and tonic quinine. We give them quinine sulfate for that. Comes with that. I don't look at the what we call idiopathic cause, that is the unknown cause. I look for the known cause first. So what you would want to make sure, you want to make sure that one, the cramps not coming from poor blood flow. So you want to make sure that they have pulses, that you can feel their pulses. They don't have a blockage of their arteries. That's a very important one. You can get cramps, you can get pins and needles, you can get pain. So you want to check that. Secondly, you want to make sure that it's not coming from the nerve. So nerve trapping, if someone traps a nerve, they can have different sensation in the body, can mimic cramps. So they may have pins and needle or something, and they say describe it as cramps. So you want to check that the nerve is okay. And there's a condition called restless leg syndrome, where these patients get abnormal sensation in their leg and they have an urge to move it. And that is usually called, we don't know the exact cause for it, but it's theorized that there is some neurological sensitivity of the nerve.
Okay.
So these are the conditions, but importantly also, you want to check for identifiable cause. Like if your iron is low, you can have cramps. If you have low calcium, you can have cramps. You have vitamin levels, you can have different sensation problem. B12 can cause sensory problem in your legs. So anyone, vitamin D level, B12, iron, and calcium levels, magnesium levels, I want to check those. So I want to check your blood supply, your nerve, and your vitamin levels.
Brilliant,
And then
Doc.
if I can't find a cause, I say unknown, try some quinine.
Okay. With gin and tonic?
Gin and tonic, maybe.
All right, brilliant. So we're gonna start with these are last week's questions, Doc. Can you shed some light on fibrosis of the lungs?
That's a big topic. Fibrosis is a long, I think we'll probably have to take a special topic and talk about it. But let me break it down quickly
Yes.
if we've got a couple of minutes. So I said to you that the lung has got a natural elastic process. You breathe in, it stretches and it recoils and the air gets out. If you have inflammation of the lung, it can cause recurrent inflammation, can cause the lung to lose its elasticity and the tissue become fibrotic. So it's not stretchy anymore. It lost the architecture and everything get lost and it doesn't get stretchy. So that is called fibrosis. What causes it? Lots of time we don't know. It's called idiopathic pulmonary fibrosis. But there are other causes like inflammation, chronic inflammation of the lung. So it can be associated with autoimmune disease where the body attacks itself. It can be associated with infection, so viruses, bacteria, pneumonia, bleeding in the lung, so a certain trauma of the lung and blood clots of the lung can also predispose you to it, any inflammation of the lung. What else? There are certain environmental allergen. So silica, dust coal dust, people who work in mines. Those components can mount an immune response and cause inflammation, then which leads to fibrosis. So it's a big topic,
Yeah,
and
yeah.
that's your fibrosis in summary.
All right, we got about 3 minutes more to go. So let me get this. The next question is, Doc, please shed some light on frontotemporal dementia.
Oh, sure. So, okay, that's another big topic. I think I would let us do dementia next week. So, for the
Okay, good.
viewers, we'll do dementia next week. But let me give you a little summary for that viewer. So, dementia is loss of cognitive ability of the brain. So, you're losing your memory and your cognitive ability and your skills and executive functioning and things like that. All right. So that is defined as dementia, and there are many causes of dementia. Like Alzheimer is one cause of dementia. If you have low blood flow to the brain, we call it vascular dementia. So the people who are at risk of stroke and heart attack, they get blood flow issue that can cause dementia. There's another condition called Parkinson's disease that can cause dementia. So there are lots of conditions, but there's a special type of dementia called frontotemporal dementia, and this usually occur in younger patients. And frontal, so the brain is divided into frontal, temporal, occipital, different lobes, different sections of the brain. And the frontotemporal area, when you look at it in the scan, it's atrophied and there is neurodegeneration. So the brain starts to shrink and it's degenerative. And that
We'll
causes
talk about that
frontotemporal.
next week. Yeah.
I think we'll talk about it
Yeah,
next
because I
week
don't
in
want
more
time to run
detail.
out. I won't want time to run out without me getting in this next two questions, right? Quickly,
Yeah.
Doc, does high cholesterol causes you to have shortness of breath?
High cholesterol can cause shortness of breath because high cholesterol, but per se on its own, probably not. But because high cholesterol can cause heart attack, heart failure, and other conditions that affect the blood flow issue, it can eventually lead to shortness of breath because you have, let's say, angina. So people with high cholesterol may not have a heart attack, but they have angina where there's less blood flow to the heart, and they will have shortness of breath as a result of less blood flowing to the heart. So I think I mentioned that the last time that you can have and shortness of breath as a sign of a blockage of the heart. Like how you have chest pain and you say, hey, I'm having a heart attack, or chest pain and you say, this is angina. You may not have chest pain and you may just have shortness of breath, and that's a sign that there's a blockage of your heart. So I have had patients with just shortness of breath. When I checked them, they had a blockage of the heart. They had to have bypass. It was so
Great.
bad.
Wow. Thanks for answering that, Doc. Quickly, if I can get this one in, and I think we did subjects on this here. Good evening. Could you say why water accumulates in the lungs? And I think we
Oh,
did
so
several.
water,
Yeah.
yeah, several topics. We did heart failure. So heart failure, so the heart pumps blood. So water in the lungs, we call it pulmonary edema. So fluid in the lungs. So it can come from different causes. So you can get pulmonary edema. The most common cause, I would say, would be heart failure. Kidney failure, heart failure, liver failure, they can all cause accumulation of water. The heart pumps blood out. If it can't pump enough blood, the heart fails and there's a buildup of fluid, and that fluid gets into the lung. Also, if your kidney cannot filter, excrete the water, you have a buildup of fluid. The liver as well, it produces protein to keep the fluid in the blood vessel. If you have less of that, it excretes out of the blood vessel, gets into the lung. So there are various reasons for fluid in the lungs.
All right, Doc. Thank you. Thank you so much for all of that. I'm sorry to push you for time, but we don't want to get cut off again. Viewers, thank you so much for joining us. What would you like to say in closing, Dr. Saw?
No, I'm happy that we're continuing this in this format. I don't know if the viewing is right. For the viewers, they can give us a feedback. But yes, thanks again, Akash, for getting this in. And yeah, thanks to the viewers for tuning in. I'm looking forward to see you guys next week. And sorry,
Good.
I sometimes, half an hour is such a short time, and we tend to
I know.
cram a lot of thing into it.
Yeah, yeah,
But
yeah.
nevertheless, we're getting there.
All right, good. So viewers, thank you so much for joining us this evening. It was a pleasure being out here with you again. We'll be coming to you. Remember, we come to you every Tuesday night at 8 o'clock live on the Ghanaian Critic platform, on my platform, and Dr. Saw's page also. And you can share this message with all your friends and family and tell them to get on board with this show, Ask Dr. Saw. Have a wonderful